We are live here on YouTube Live. Haven't done a YouTube in a while. But I decided to do this today because of some more new information. It's nothing new to a lot of you that perhaps have been taking fish oil for some time, like I have. And I'll explain to you in a little while why I've become such a purist for fish oil, why I think it's so important. But I want to read to you this article that came out of an interesting journal. A Dr. Farrell, S.W. Farrell, did this on an issue called Prostaglandins, a journal dealing with anti-inflammatory fats. We're going to talk about this. And I'm going to roll this over to another article that comes out of Dartmouth University just today that talks about fractures, bone health in women. And it may not be an issue with you, but I will tell you, sitting in my chair over the last 4 to 5 years, the number of women that have called saying all of a sudden they have osteoporosis, osteopenia, their bone health has not been good, has skyrocketed. So we've been looking for excuses. Why? Well, we're going to talk about that. In fact, let's do that first. The Gesell, interesting name, School of Medicine at Dartmouth came up with this that says findings in this new study published in the Journal of General Internal Medicine reveals that there is a substantial variation across different regions of the country in the intensity of fracture-associated drug. This is fractures that have been related to medication, especially among long-term care facility residents, and that areas with greater use of prescription drugs, greater use of prescription drugs, more than 2, more than 3, experience higher hip fracture rates. In recent decades, the use of prescription medications has increased dramatically in the United States. It's the way we medicate to health, right? Due to factors such an improvement in the ability to detect disease, expanding treatment options. I'm telling you what, as a pharmacist, I've seen so little as far as new breakthrough drugs over the last 4 or 5 years. Whole myriad of Me Too drugs have come out. Now, could this be attributable to an aging population? Sure. For many Americans over the age of 65, these medications provide an effective means of managing disease and improving quality of life and longevity. However, this is the big but, more commonly prescribed drugs such as, here's the category, I want you to make a note, opioid painkillers, number 1, sleep aids, number 2, and there's a whole myriad that falls under there. You know, we take medications like Xanax, some of these benzos, they're sleep aids. Trazodone, sleep aids. Buspar, sleep aids. Seroquel, sleep aid. There's a whole category of those. Diuretics, water pills, a myriad of those. Antidepressants. You know, it's been estimated that nearly 70% of women over the age of 40 are on or have been on an antidepressant. And lastly, acid blockers, the category of antacids. So there's your biggies. An opioid pain reliever, which a lot of people are on. Sleep aids, diuretics, antidepressants, and antacids, all known to carry an increased risk of breaking a bone. Now, they say it can cause this by increasing the risk of falls, and it could. Weakening bones by their very nature, it does, or both. This is especially true for patients whose fracture risk is already high due to conditions like osteoporosis. So let me ask you a question. Do you think many doctors, when they do a DEXA scan, will in any which way blame the osteoporosis on the prescription drugs they're prescribing? I'll give you 5 seconds to think about it. I doubt it. In our previous research, we showed that combining 3 or more of these drugs carried a 4-fold risk of a hip fracture, and that exposures to these medications for residents in long-term care facilities was nearly twice those of those living in community dwelling. So you live in a nursing home, obviously, whether you wanted to or your kids put you there, you had almost twice the risk factors of being on some of these medications. In this study, the investigators sought to determine how much regional variation exists in the intensity of these drugs in long-term facilities and to assess the association between the intensity and hip fractures. They analyzed Medicare administrative data and prescription records for 422,000 long-term care residents, comparing the use across hospital referral regions, and observed more than 36,409 hip fractures among these residents over an 8-year period. Areas with the greatest multiple drug use were in the Southeast, Ryan, Gulfport, moving up into Minnesota, Louisiana, and Oxford, Mississippi, Alexandria and Monroe, Louisiana, and Miami, Florida, while the lowest intensity was in the Bronx, New York, Bend, Oregon, Albuquerque, New Mexico, Honolulu, Hawaii, and Sun City, Arizona, probably because of vitamin D. The researchers found an average difference of 12% in the range of these drugs prescribing when compared to hospital referral regions. Seeing such variation in the intensity of prescribing of these risky drugs across the vulnerable population adds to the evidence that guidelines aren't necessarily being followed. We hope these results contribute to a more considerable weighing of the risks and benefits when combinations of these medications are prescribed. Will doctors wake up to the point of saying, all right, enough's enough. Maybe I need to back off on that Prilosec OTC. All right, now, when we talk about a weakened heart, which is, again, another huge problem, the obesity epidemic, diabetes, etc., and you want to get into what's called heart rate recovery, you want to, what your doctor said, we're going to put you on a exercise program, a walking regimen, an aspirin a day. We're going to go through a whole myriad of things. Entresto, we're going to medicate you. A new study shows that if you do what's called an omega-3 index, and I guarantee your doctor's never heard of this, where you can actually measure omega-3 levels right on your red blood cells. It's part of the Boston Heart screening that we do on a regular basis. Subjects with an omega-3 index in the decent range showed more rapid heart rate recovery after exercise in this new study. So they wanted to do a study, and how are they going to induce a stress on the heart? Exercise. The results suggest a cardioprotective role for these essential fatty acids. Study was published recently in the journal Prostaglandins. The research hailed from the Cooper Institute in Texas and from universities in Iowa, California, Texas, and South Dakota. The research was structured as an observational study using data from 14,000 patients who undergo a comprehensive examination at the Cooper Institute. The Institute is a research facility founded by Dr. Kenneth Cooper, whose 1968 book, Aerobics, helped to transform how Americans saw exercise and its role in supporting health. As part of their examinations, the participants underwent a maximal treadmill test as well as comprehensive blood tests. Most of the subjects fell into the 4 to 8% omega-3 index range, which a small number falling below 4 and even a smaller number having measures greater than 8. The higher levels considered the threshold for achieving the greatest health benefits, 8% on the red blood cells. Comparing the samples to what omega-3 testings from this quantitative index had found in studies showed that the Cooper Institute subjects scored slightly higher on average omega-3 index than does the typical American. Omega Quant was founded by Dr. William Harris of the Sanford School of Medicine, University of South Dakota. After performing the maximal treadmill test as part of their comprehensive exams, the Cooper Institute subjects had their heart rates measured at 1 minute, 3 minutes, and 5-minute intervals. The research found a distinct correlation between faster heart rate recovery at the 1 minute and 3-minute intervals, and by 5 minutes, the differences between the groups had become negligible. So it was a much quicker result taken. Again, this is in a very short term. That might be partly attributable to the overall good health of the study population. The subjects had resting heart rates of around 60 for the men, 63 for the women. Although resting heart rates can vary due to genetic factors, generally the lower your resting heart rate, the healthier or better trained the individual is. Most heart rate charts show that between 72 and 76 beats a minute is about average for a 50-plus-year-old American. It might be expected that a less healthy cohort would include more individuals that would take longer than 5 minutes to recover. A direct relationship between heart rate and these values was observed in both men and women. Harris said the precise mechanism on which these fish oils have been fully elucidated hasn't been seen, but years of longitudinal studies and observational studies like this one show unequivocally that it's there. And this is not the synthetic junk that they're writing prescriptions for. You could say that this study shows that a higher omega-3 index makes the heart light on its feet. It's tuned properly, and it's not sluggish in its response. Harris said research has shown that omega-3s have important effects in the membranes of cells, helping forestall the formation of rafts in membranes where bioactive proteins gather instead of being dispersed from the cells where they are available to perform their functions. Is that the reason for the effects? We're not sure. However, it's worth noting, Harris said, that the researchers were able to observe any effect at all, given the issues. This is definitely a healthy population. It's hard to see benefits in that healthy situation, so maybe it's remarkable that we saw anything in a healthy cohort. More omega-3s, the better the heart rate functioning recovers. Now, one quick word on fish oil. I have become a purist on the fish oil concept forever. One thing that I dread is ever tasting fish oil. I don't want to burp it, don't want to taste it. So I've been stressing for years digestibility. I want it done correctly in such a way that it's balanced and ready to go without any complicating factors so that you can take it, digest it, and assimilate it. That required cold processing. But to start out with, it required what's called non-pelagic fish. You got to start out with the raw material. Fish that comes from the deep parts of the ocean, not along the coast where there's prone to be more pollution. Then they need to be cold filtered. And then they need to be cold distilled. And then cold distilled again. And then balanced. And we had some vitamin D right in there as a balancing agent with it. I just got off the phone with somebody whose fish oil was balanced with a synthetic form of vitamin E, D-alpha tocopherol acetate, sort of a derivative from mineral oil. Okay, not good. So our omega 900s are done that way. And in a form with a capsulation that can actually be chewed if you wanted to. I do. What do you mean? You don't want that taste of fish in your mouth? No, you don't get it in your mouth. If it's done correctly, fish oil should not taste like fish. How about that? So when we look at this and say, let's get it balanced, let's get it done right, let's get it in your system. Our omega 900s are available at our office by calling 678-228-8900 or look at them right on our website at thenutritionshop.net, THE. 678-228-8900. Please share this with others, would you? God bless you. See you back here soon. Take care.